In 2015, Southern New South Wales was approached by the Agency for Clinical Innovation in relation to some funding that was available for rural areas to support rural and remote access to the delivery of a chronic pain management service. The funding for the chronic pain management service was an initiative of the Minister for Health at the time, Gillian Skinner, to enable better access and equity for rural areas to chronic pain management services. The chronic pain management telehealth service with St Vincent's has enabled a partnership between the Primary Healthcare Network, the LHD, being Southern New South Wales Local Health District.
In 2016, we established a multidisciplinary outreach telehealth pain clinic.
Discovering that I could do a telehealth clinic, have an appointment with a specialist on a computer, was enormously helpful. To get to Canberra is 2-3 hour trips, which I've never attempted to do in one day because of my back issues. To get to Sydney would be a 3-day trip.
Pain management in rural centres is very complex and difficult and under-resourced. What we actually offered is that GPs would bring complex patients on through the telehealth to our clinic on Fridays, and we would set up a telehealth consult. And that would often be with one pain specialist, but often it would have with us in the same room about 4 or 5 other people. There would be a psychologist, a physiotherapist, a psychiatrist, and sometimes a second pain specialist.
Initially I had an hour or so appointment with Dr. Sun, a professional pain clinic specialist, who took my life history, and at the end of an hour it was suggested that I do some other work with the psychologist and physiologist, and I have had a course of 3 sessions with each of them, and they have been extremely useful.
We see our role as supporting the GPs in managing people with chronic pain. So we try to assess patients more holistically, look at all aspects of their life, their quality of life.
They provide Mr. Firth with an all-rounded care in terms of pain management, so not just the medication alone, but in terms of lifestyle, exercise, and the mental health part of things as well.
So I've been able to do consultations as an individual physiotherapist, but also with our psychologists, which has been fantastic. We've been able to really give them the multidisciplinary approach that we know is the most effective approach for chronic pain.
After the initial consultation, we would feed back to the local doctor as to what we felt what are the issues, and advise our plan of management.
It has also enabled GPs to more confidently and appropriately deliver the service to the people in our communities.
It's good to have an input from a specialist regarding what more can be offered or what's the better management plan for this patient.
So pacing is a key component of how we approach chronic pain. So a lot of chronic pain patients will fall into either a boom pattern of activity where they do a lot of activity when they're feeling good, and then they bust and then they're inactive for a few days. Or we have the other group that surrender to the pain and they stop their activity altogether.
Now I am much more conscious that with pacing I can recognise the symptoms of pain and avoid doing things, alternating things, working out better ways to do things.
Advise the GP what sort of tablet is more appropriate, or how to manage people who might be on high doses of morphine or opiate analgesics.
And it really has enabled those people to live their life fuller and also feel that as a health service that we're supporting their chronic needs at home.
And now with the help of this clinic I am further reducing my painkillers and other supporting drugs. It has taught me that I can self-manage my pain, my physical disabilities, increase my enjoyment of life through that, and to reduce the amount of mechanical and chemical aids that I have been using as the simple option. Although accepting the pain is there, to not let it manage me. I now manage my pain.